So let's talk about how to approach a case of diarrhea in the MRCP PACES examination. So in the long clinical consultation, you would have 5 minutes outside the station to prepare, 15 minutes inside the station with the surrogate or a patient to take his history and examine him, and then 5 minutes viva with the examiner. During the 5 minutes outside the station, you will be given an information, a scenario with the patient's name, age, and his presenting complaint, which would be diarrhea or loose stools in this case. This is the minimum amount of information that would be given. Other hints could be the duration of the diarrhea, any possible associated symptoms, or the vitals of the patient. I'll tell you how to effectively use this 5 minutes to prepare. You would be given a pencil and a paper outside the station that you will be allowed to take inside with you. So you note down the patient's name, age, his presenting complaint, and the duration if given. Look at the vitals and note down if there is anything abnormal. Now note down what you would like to examine. So in every case of loose stools, write down or just scribble down general physical examination, specifically the mucous membranes for dehydration. Write down a detailed abdominal examination, which is mandatory in this case, and write down what you would also like to check in this case. So it's important to check the blood pressure, even if it's given outside. You would offer the examiner to check the blood pressure again, postural hypotension, and postural tachycardia. This is very important to establish if there is any dehydration with the diarrhea. So, besides that, you would also write down any type B symptoms or constitutional symptoms such as fever or lymphadenopathy, night sweats, weight loss. This would be to establish whether there are any red flags with the diarrhea. So, again, in summary, you would write down the biodata of the patient, the presenting complaint with its duration, write down general physical examination, detailed abdominal examination, and postural tachycardia with postural hypotension. And write down mucous membranes or check oral mucosa in front of the general physical examination. Other examination will be relevant after you take the history. So this is a basic template that you will apply on every case of diarrhea. Now, while you're outside, the information given can give you a hint as to what the possible differentials could be. So, depending upon the age, the sex, and the duration of the symptom, you can get an idea of what the case could be. For example, in younger females, you can expect hyperthyroidism, maybe laxative abuse, or functional disorders such as IBS. If it's an older male patient, you have to rule out red flags and malignancies. So, what you see on the screen is just a template that you can use while preparing. This is not to be written down during the examination. So what you see is, besides GID, which is the main system involved in diarrhea, there are other systems that can be involved as well. For example, in endocrine, hyperthyroidism and diabetes can be possible causes of diarrhea, and pheochromocytoma is although uncommon, but still a possibility in the PACES exam. There are drugs which can cause side effects such as steroids, metformin, and SIDS. If the patient has any connective tissue disorder such as systemic sclerosis, you can expect an association with small intestinal bacterial overgrowth that can present with diarrhea as well. So, vitamins is a mnemonic which basically has all the etiologies which can be applied to any possible symptom. So, they can be vascular causes, infectious, trauma related, autoimmune, metabolic, inflammatory, neoplastic, and psychological causes of every symptom. This is just to give you an idea while you're practicing for the exam about the various causes that you need to think about while taking the history. Now, talking specifically about how to narrow down your differential diagnosis while taking the history, let's go to the three categories. While you're taking the history, it's important to establish whether it's acute or chronic, whether it's infective or non infective, or if the origin is small bowel or large bowel. Every question you ask will narrow down your differentials, and you can then once you've categorized into one of these categories, you can then apply the relevant algorithm to reach to a definitive diagnosis. So starting with the history, these templates are available on the Instagram page of PACES Guide. You can refer there or take a screenshot. So, starting with the introduction. So, the first 4 or 5 points are fixed. This is a fixed beginning in every LCC. Practice this so you get very fluent, so you can get a good impression on the examiner. So start with greeting the examiners when you go inside the station. Introduce yourself to the patient. Say, "Hello, my name is Dr. X. I'm one of the doctors in the clinic today. May I confirm you're Mr. XYZ and you're 40 years of age?" Then set an agenda. "We are here to talk about your health condition. I'd like to ask you a few questions and then examine you afterwards. Would that be okay?" So you've set an agenda, taken permission. "Okay, so I've gathered from your notes that you've been having loose stools. Can you tell me more about it?" Now, there are two approaches. Some people suggest asking an open ended question, but the surrogates or the patients are given a script and they're guided to not offer you any information unless you ask specifically for it. So, there's usually no benefit of asking an open ended question, and sometimes it might give the examiner or the surrogate an impression that you're not sure about what brought him to the hospital, because it's clearly written outside. You have been given a note and it mentions what the complaint is. So it's better to ask specifically about his presenting complaint. So the patient is going to tell you, "Yes, I've been having this complaint for the past so and so weeks or months." So express empathy. When you hear about his complaint, express empathy early on. Say, "I'm sorry to hear about that. I'll try my best to help you out today." That is enough. So you can save time. You don't have to, this is not a clinical communication station. You can be very brief about it. Okay, so the first 5 points are fixed in every station. Now explore the main symptom. Every question we ask for diarrhea is going to give us an idea about what the differential could be. Each and every question is very important, has its own significance. So it's different than the conventional Socrates or Odipara. Although these Odipara questions can be asked, but the approach in case of loose stools would be a bit different. So you can start with, okay, so when did this begin? This will give you a duration. It started either 3 days ago or maybe 2 months ago. So you have an idea whether to apply a chronic diarrhea algorithm or an acute diarrhea algorithm in it. The next, okay, so was it, how did it begin? Did it come on suddenly? So this will give you an idea of the onset. If it's acute, or maybe even if it's chronic, was there an acute worsening? The patient will say, "Yes, I was doing fine, and then all of a sudden I remember eating outside, from a hotel, or maybe ordering takeaway, and then I got this bad case of diarrhea." Okay, he might not offer all this information unless you ask for it. So this will give you an idea of whether it was sudden worsening of a chronic condition or a chronic condition. Okay, so how many episodes per day do you get? So it could be less than three to five, or more than six, indicating the severity of the diarrhea. Okay, is it watery or semi-solid? This can give you an idea of, again, if it's watery, semi-solid, or just the consistency. Give you an idea of the consistency. The next step: does it have any blood or slime in it? Some centers don't accept mucus as a regular term, a layman term, so use the word slime. Or you can say, do you have you noticed any blood in it, or have you noticed any mucus or slime in it? Okay, the next step would be, do you have to get up at night to go to the loo? This is very important because it can differentiate between organic causes and functional disorders. So, in case of an organic cause, the patient would have to get up at night as well. So, and then before going into the details of the diarrhea, you can offer just an apology, because these are some personal invasive questions. You can say, "I'm sorry to ask you about this, but have you noticed your stools are, or your loose stools are difficult to flush? Do they stick to the pan? Do they float in the pan?" So these are the specific sentences that you need to use. These establish whether it's a malabsorptive diarrhea. You can also ask about the quantity. In terms of the quantity, would you say they are of large volume, or large in quantity, or small in quantity? The next step would be, many candidates ask about whether they're foul smelling, but some examiners do not like this question, and some examiners have written some very harsh feedback if this question was asked, so you can avoid asking this. Okay, so now that we've established this Oripara can be applied again, you can ask, okay, do you think this is getting worse with time or better with time? Have you tried anything, any medications for it? And the patient might tell you about it. A very important question would be triggers. Have you noticed anything you eat that triggers your diarrhea? Maybe anything, any milk or dairy products? Ask about gluten. Don't say wheat or gluten. Um, Name specific food items, such as, have you noticed it gets worse with pizzas, pastas, or breads? So it can give you an idea of gluten sensitivity or celiac disease. Do ask about if there was any trigger. Did you recently order takeout or eat from a hotel or a restaurant? Has anyone else from your friends or family experiencing similar complaints? Now you can ask about travel history at this point or at the end as well. So it depends on you. If you think this is an acute diarrhea and it's relevant to ask a travel history, you can ask at this point. Then comes the constitutional symptoms. Ask about, have you noticed any raised body temperatures? Don't say fever, it's considered a jargon in the exam. Have you noticed any raised body temperatures? Any night sweats? Any lumps or bumps on your body? So lumps or bumps indicates lymphadenopathy. Any changes in your weight? It's better to ask about weight change instead of just weight loss. Okay, so if the patient, yes, he has been losing weight, you need to quantify. Okay, how many kilos over how long to see if it's significant. Then ask in the same go, you need to ask about his appetite. Have you noticed any change in your appetite? And has there been any change in your diet? So these questions are very important. Do ask about, may I please confirm if this weight loss was intentional or unintentional? I mean unintentional. So it's always unintentional in these cases. All right. So the next step would be to ask about some associated symptoms. You can also mention again the relieving factors or alleviating factors. What makes it better? What makes it worse? The associated symptoms would be, have you noticed any tummy pain? So all the symptoms pertaining to GID. Have you noticed any tummy pain? Feeling sick or throwing up? Feeling sick is nausea, and throwing up would be vomiting. Don't use the terms nausea or vomiting in it. If the patient does mention any abdominal pain, you need to apply Socrates to that pain symptom. Where exactly is it? Can you point it out? How did it begin? How long does it last? On a scale of 1 to 10, with 10 being the most severe, how would you rate the severity? Does it go anywhere else? Maybe your back? Um, what makes it better? What makes it worse? There's also a question of tenesmus. So when you go to the loo, after you've gone to the loo, do you feel that you still feel the urge to go again, or do you get the feeling of incomplete emptying of your bowels? This can tell you about tenesmus. Now, all these questions are very relevant to establish the origin of the diarrhea. So here is a visual representation of the questions we asked. If the patient mentions it was a large quantity stool, um, with maybe it's 3 times per day, 4 times per day. There's no tenesmus. There is steatorrhea, slime in the stools, difficult to flush, floating in the pan. This points towards a small bowel cause. Whereas if it's small quantity, frequent episodes, after every 15-20 minutes, maybe after an hour, it has slime in the stool. He has tenesmus, then it points towards a large bowel origin. So, depending upon what the symptoms are, we can then easily classify into one of these categories. So, these are the infectious causes: Salmonella, Shigella, E. coli, B. cereus. These are all acute causes. GRDSs can be chronic. TB and HIV again can be acute or chronic. So you can then, if there are constitutional symptoms, an acute onset, it will denote towards one of these causes potentially. Pancreatitis, if the patient has abdominal pain in the upper abdomen, radiates to the back, maybe he's an alcoholic, you can get an idea about pancreatitis. Now, if the patient has small bowel diarrhea, If there are any dietary triggers, think about celiacs or lactose intolerance. Now, the other causes given here, you can ask some specific questions. So, if there are constitutional symptoms, chronic diarrhea, significant weight loss, apart from infectious, you can think of lymphomas as well. Now, for the other causes, you can ask specific question. You can add carcinoid syndrome in this as well. You can ask about does he ever feel like flushing, flushing of his face, blushing on his face, any sores in his mouth. This can denote towards Crohn's disease. And as opposed to this, you can also get diarrhea of the large bowel origin. So if he has blood in the diarrhea, um, it can point towards ulcerative colitis or colon cancer. Ask about his previous hospitalizations, any known medical conditions, any medication history, recent antibiotic use that could possibly denote radiation, colitis, or C. diff. Ask specifically about radiation if he does mention that he has a past medical history or he was hospitalized. Um, so this is the rest of the history taking pattern. You can go on from there. So now that you've taken the detailed history of diarrhea, explore the GIT system, then go toward the review of other systems. You can just go through a checklist manner. You can say to the patient that I'd like to ask you a few questions. You can answer in a yes or no manner. So you can ask just one line questions in rapid succession, and they can say yes or no. So have you ever had any headaches, any dizziness, any problem with your vision, any difficulty in swallowing, any pain while swallowing, any chest pain or racing or pacing of your heart, any breathlessness, any chest discomfort, any burning in your chest, any numbness or tingling in any part of your body, any weakness in any part of your body. Now, out of these questions, some questions about dehydration are also very important. You need to ask whether if he's facing how he has been compensating for the dehydration or the diarrhea. Has he been drinking more water than usual, or if he's experienced any headaches or dizziness that could denote dehydration. Now, the next step would be past medical, medicine, and surgical history. You can ask about if he has any non medical conditions early on when you ask about the presenting complaint. So it's not a fixed pattern. You can approach it in any manner. So it's usually easier if you ask about any medical conditions in the beginning, but you can explore the details later on. Ask about his habits. Do you smoke? I'm sorry to ask you this personal question, but do you smoke? And if he does, how many cigarettes a day over how long? Now, even if it's one or two cigarettes a day, you need to stop smoking. You can say smoking can be injurious to health, and I would advise you to stop smoking. Have you ever considered it? If you need any help, we can refer you to the smoking cessation service. Would that be okay? Ask about have you ever used any recreational drugs? Do you drink alcohol? And if he does, quantify. So how many units or how frequently? So the weekly limit for males and females is 14 units a week, and it should not exceed 2 units per day. Ask about so what do you do for a living, and how are these symptoms affecting your life, and offer some empathy at this point. So do you drive? It's not really applicable in this case, just for loose rules, but it depends if he's having problem with driving. So there is no need to stop driving in general. Ask about family history. Do you have any significant family history or similar complaints in your family? His sexual history. Again, say I'm sorry to ask you these private questions, but it's important to get to know more about your condition. And we ask these questions to all of our patients. Do you have any regular or casual partner? And if he does have a casual partner, ask about if he uses protection during the intercourse. If it's a female, ask about pregnancy. Do you have any children? I'm sorry to ask you this, but have you lost any pregnancies or suffered from any miscarriages? Are you on any birth control pills? And may I ask, are your periods regular? Make sure to ask all this in every female of childbearing age, especially, and travel history. So it's important in cases of diarrhea. It's very important to ask about travel history. Have you traveled anywhere recently? If the patient has traveled, ask about so where did you go, and how long did you stay there? Did you eat any street food? Did the water you drink there was filtered or boiled? and ask about some other activities that he was involved in while he was there. So this can give you an idea. And ask about if the people who travel with him are experiencing the same symptoms. So I hope this helps. I will try to upload the questions, the list of questions to be asked in diarrhea, hopefully soon on the Instagram page. So you can go and follow the page there. If you have any more symptoms or complaints that you're experiencing difficulty with, please write down a comment below, or you can DM me on Instagram. I'll try to upload another video soon. I'll try to cover back pain next, hopefully in the next few days. So thank you for listening. If you want any help, free study materials or study plans, please you can DM me. And if you want one-on-one coaching for both LCCs and clinical communications, you can DM me. Thank you for listening.